Anyone want to volunteer to do it? Okay, Diane's going.
Let's pray. Heavenly Father, Lord, we ask that you look down on us with your blessings tonight, Lord, as we go about the business of Scotland County. And Lord, we ask you to look around the table and bless each and every one of us and just wrap your arms around us tonight, Lord. Lord, we are so grateful and so thankful for the many blessings you bestowed upon each and every one of us. And Lord, we are so thankful that Sharon is married and that ordeal she went through is all over with, Lord. So thank you again for your blessings, Lord, and thank you for allowing us to go about the county's business. In Christ's name we pray, amen.
Amen. Thank you.
You're welcome.
You have the ability to mute people when they're out there.
They're muted.
So we have an agenda before us. We're supposed to discuss it and then adopt it. Any discussion regarding the agenda? If not, I'll call for approval of the agenda. All in favor, say aye. Opposed? The next item is the approval of the minutes. I'm sure everybody's read them back and forth. Any corrections or additions to the minutes, changes to the minutes necessary?
Move to approve the amendments, the minutes. I move to approve the minutes.
We got a motion? Second. Any further discussion? If not, all in favor say aye. Opposed? Thank you. Public comment. Do you have any public comment? Or people who want to make public comments, are they supposed to tell us before the meeting? That's a regulation. Okay, yeah. In case that comes up sometime. All right, administrative reports to start with the money man. Go for it, Tim.
Good evening. This is the finance report for the health department as of September 30th, 2022. These are the expenditures. So far it should be at 25% used. You can see we're at 18.8% as a total. I know you see that big number at the top, the administration number. I did talk to county finance today, and that is an error. For some reason, when they done the budgetary numbers, they made an error. So please know that we are not at 46.8% expended in admin. That is a figure, but they can't change that figure on their end until later on in the year. So you'll see that figure stay there for a little while. So, but just know that we're not really, I don't know how to explain it other than that. They made a mistake.
It's not your bonus?
Not mine, no, sir. No, sir. Maybe somebody, not my bonus, no. So everywhere else, as you'll see, we're currently under budget. Except for immunizations, we're really close, but that's because we have to purchase private vaccinations. And then we in turn make money off of those. Any questions on the expenses? Okay, the next page will be the revenues. You see we're 3 months at 25% collected. We're currently at 6%. Do know that it takes, we're a month behind. We've talked about that before, about how everything comes a month behind. Also, some of my stuff is a month behind this. If you do not already know, or have not already heard, the state has been down since Wednesday of last week. Their state system, their NCR system, their NCID system, their aid to county where I draw down money from, everything's been down since Wednesday. So there's no way for me to pull certain reports for me to give to you guys. So this is the best I could do with what I had. So, but everything should be fixed next. I got an email today that they were supposed to be back up and running tomorrow. That's what I was told. So, we get those numbers up. Plus, a lot of the stuff that we've been getting paid for in August and September were for bills for last year. So we always have to code that back to last year's money. So that's why some of the stuff is missing here. Any questions? Okay, very short and sweet tonight.
Thank you.
Thank you. Amanda, what the activity summary?
Sharon, was this Donna's?
No, ma'am. These were the monthly activity numbers for August and September. That was also included in the board members' packets.
Oh, for 20, 21, and 22.
Mhm.
Anybody have any questions on those? Okay, in the last 2 months, we have had a couple of staff meetings, to discuss need for, changes. We've discussed employee morale and the detriment of negativity and gossip in the workplace. We have, established employee recognition committee, and they have scheduled a few events for employees for Halloween, Thanksgiving, and Christmas. I visited Jackson and Swain counties to look at their billing and, different policies that they have in their county. I attended the Region 6 Health Directors meetings on September 21st through 22nd, and we discussed COVID and monkeypox and the retention and recruitment of various positions. We had our State Health Directors meeting in Wilmington on September 13th through the 16th. I met with Dr. LeGrand with the school district, and we talked about, coordinating some different things and hiring a school liaison person that we have COVID money for that has been sitting there for about 2 years, and we have not been able to get anyone hired. We've not really had a whole lot of applications for that. I think it's because it's a temporary position, and we only know from year to year if they're gonna give us the funding for it. We also talked about the need for sports physicals, possibility of the health department providing sports physicals for, the athletes. Right now, I think Occupation Health is the only place in Scotland County to get the sports physicals.
They do, and they set that up every year, in late April or early May. They pull providers in to do them.
I met with emergency operations with Robert Sampson, the director at EOC, and April Sneed with DSS. And we're working on updating the county's emergency operations plan. And also met with Spectrum. They're updating our security cameras on our end and on DSS end. Okay, Shani. We have updated the dress code policy, the confidentiality policy, and workplace visitation policies. We also have updated our orientation process for our new hires when they come in, meeting with the various departments to kind of get oriented on what each department does. We found that there was a need to update our seafood ordinance. We had a local business that, a new business, Seafood Express, that was wanting to open back in June. And they were unsure the process of getting open because the Department of Agriculture does an inspection, as well as our environmental health does an inspection. So the county manager asked me to look to see what the process was so we could advise the lady on how to proceed. And realized that the seafood ordinance was last updated in January of 1980. So I reached out to our county attorney. I contacted Bladen County and Craven County because they've recently updated theirs. And we used theirs as a guideline to go by and modified it for our county and sent it to the attorney to review. So you'll see it in your packets. We've updated our strategic plan. I have updated the purchase requisition form for the health department and the procedures for purchasing. All of that now goes through me and Tim. Updated travel request forms. If someone wants to go overnight travel, it comes to me, and if it's overnight travel, I send a request to Beth Hawks and Kevin Patterson for approval. We've also been doing some renovations here at the health department. We've taken down some of the older bulletin boards and replaced it with the enclosed glass bulletin boards to be, more up to date. We removed the tables that were in the long hallway out here and replace it with just one health resource table. We are in the process of rearranging management support and the personnel office to make the flow more efficient up front. And we've replaced the old chairs in the WIC lobby with new sturdy chairs, because the chairs that were in there had been there a while, and they were rusty and causing rust on the floor. COVID updates, we were trending down for the month of September. We had a community risk, low community risk. For the week ending October 6th, we had 30 positive cases, 7.2% positivity rate, with only 3 new hospitalizations for that week and 0 deaths. We had 64.9% of the citizens with 1 dose and 50.2% that are fully vaccinated. We are still giving out the free at-home COVID test every Monday and Tuesday from 9 to 11 and 1 to 3. And we have give out approximately 5,000 test kits since we started giving those out.
Can I ask you a question about that?
Mhm.
Positivity rate, what is that test done by the health department? Because we're not getting all the home tests, right?
Right, we're not getting the home test. It's, health department or any providers that report to the state.
So the hospital and the various doctor's offices. And all the home testing is just lost.
Right.
Yeah.
That's correct.
Okay.
Monkeypox, we, have had one positive monkeypox case in Scotland County. They have already went through their 21 days of, isolation. And I think, I can't read that from here, but I think it's 500 and something cases throughout the state. We have physical management and the clinical staff have received additional training on the super bill, which, with the Cure MD platform, once the provider finishes their visit and puts all their codes in there, it will move over to fiscal management and make it an easier billing process, more efficient way. And it should have less denials, because once the provider puts their codes in there, it's no more of having the billing person going back to the provider and saying, is this the right code? It should flow a whole lot easier. And we're gonna initiate that November 1st is when we're gonna start with the super bill. We're gonna be closed on the 31st for some staff development training. Training's being set up for team building, stress reduction, and customer service exercises. Staff have participated in the John Blue Festival, the Mount Calvary Leadership Community Health Fair, which was last Saturday. And Jana Blue, our health educator, provided information to the first year students at St. Andrews regarding services offered here at the health department. We've had some personnel updates. We've hired a lead child health nurse who will be reinitiating, I think, the postpartum home visiting that was done previously. But I don't think that there's been a child health nurse in 2 years, 3 years?
Give or take.
So we now have a lead child health nurse here. We have hired a processing assistant for management support and one for billing. And I now have a new administrative assistant, Ms. Dontasia Harris. She will be taking those responsibilities from Sharon, and Sharon will be focusing on the personnel part full time. We are recruiting for environmental health specialists, still recruiting for WIC director and nutritionist 2, a nutritionist 1, processing assistant for WIC, a CD nurse, accounts payable, and payroll assistant, which was what Dontasia was doing before she was promoted, and a temporary health educator. And that health educator is the school liaison position.
There's Roman numerals 1, 2, and 4 and all that, and 5. Which way is going up, which way is going down?
The higher the number,
The more qualified.
the more qualified.
The more, okay.
And our goals for the next quarter is to continue working on filling the staff vacancies, continue moving items into our new storage space. We have sent some things over to I.A. Johnson already. As we have moved offices around, we have found like extra file cabinets and stuff that we just didn't have space for here. And we've moved over to I.A. Johnson. We want to continue establishing the new billing procedure and hopefully have the installation of the security cameras in within this next quarter.
So is having the new storage space clearing up, a lot more space over here in the building?
It has. We have cleaned out some of the stuff we had storage and actually turned it into additional office space that we really needed. And these are Donna's clinical updates. I think that this was in the packet.
Donna, do you have anything you would like to report during your clinical updates?
Do you have a meeting?
Donna Page, can you hear me?
Says you're muted.
Donna Page, can you hear me? Donna Page.
Hello?
Hey Donna, can you hear me?
I can hear you. Can you hear me?
Yes, ma'am.
I can hear you. Yes, ma'am. I can hear you. Yes, ma'am. I don't have anything to say about my slides unless anybody has a question. Unless anybody has a question.
Steph, do you have anything, does anyone have any questions about management support updates? Kathy, do you have anything?
Not really. The only thing that I would say is that, and I think, Amanda will be bringing this up later, this evening, so is you just kind of see what we're doing through health education.
Kathy's mentioning the opioid community forum flyer. Kathy, do you want to explain what we're doing?
Right. You all know that we have an opioid prevention and education network, but we also have an opioid settlement funding group that is meeting regularly to discuss what we can do with the settlement funds that are coming down the pipe. We have a lot of great ideas and a lot of good things that are happening right now. This being our first community forum concerning opioid and overdose. And so we're having it downtown at the Saks building. We would love to invite you all to come and hear. We have confirmed a keynote speaker. She's an MD with a lot of clinical and substance use background. And so, thank you. Yeah. And she's going to be our keynote, and then we'll have 4 panelists. So we'll have a Narcan demonstration that night for the audience, along with, they'll be able to take a box of Narcan home with them. We're going to have exhibitors there as well that are resources here in Scotland County, along with our mobile care unit. You all have maybe seen that out near the road out here on Mondays. They're here. And so we'll hear from them exactly what this mobile unit is for, what it does, the services that it provides or offers. And so it's a lot of good information for the general population to come in. And then we want to hear from them, like, what are some questions people have? How can everyone get on the same page as far as promoting prevention efforts, resource efforts, those kinds of things? What can we do? So it's an open question and answer session, along with a little bit of information from us, along with some data, some statistics and data that are the trends for the past, say, 3 years about what's happening here in Scotland County, what our overdose rates are, what our death rates are from due to overdose, that kind of thing. So it's going to be very informative, and we're just hoping, I gave you all a flyer, so maybe you could set it up somewhere and help us get people maybe interested in participating in this. This is our first one. We do plan to continue and have maybe 2 to 3 more in various areas of Scotland County, say Gibson, Laurel Hill, in the future. So maybe around January, February, somewhere there, so that we can reach all the community areas to get people to come to this forum.
Who's supplying the Narcan?
East Point and also Stevens Outreach Ministries will have some there as well.
So is it?
And EMS.
Yeah, I was gonna say, is it just the Narcan product, the 4 milligram, or is it, have they looked at the Cloxeto product, which is double the dose, 8 milligrams?
You were asking me way more than I know about that.
I'm just curious, we've been seeing the reps a lot lately, and we've kind of changed our prescribing habits some
Uh-huh.
for the insurers that will pay for it, so, because it's double the dose in the nasal spray.
How about
So,
that?
something to kind of think about.
Well, I think this is a nasal spray that Robert
Yeah.
Sampson will be demonstrating.
Yeah.
But now what's gonna actually be on the tables to give to someone from the audience that would like to take one home? I don't know. I haven't seen that, but that's a great question. And if you happen to come to the meeting, that's a great question to ask.
Notice you have a misspelling here.
Uh-oh. Well, it wasn't me. But no, I should have noticed it. Where?
It's
Personal testimony.
personal testimonies.
Oh, I will mention this to Adam, and we'll fix this.
Okay.
I didn't even look at that. I just kind of,
Will there be discussion of what's going on locally with opioids compared?
absolutely, compared to the state too.
Yeah.
Yes,
Because urban
yes,
versus rural, and also a whole different. thing.
absolutely, yes, absolutely.
This time, the doctors are not at fault. Let's make that-
Is this something you could put up in the post office?
We could, yeah.
So are they going to discuss, do they have the data on what the overdose agent has been identified as in Scotland County?
They may, Robert may have that type
Yeah.
of information.
Well, yeah,
That's
he's
available, I
in our
think.
stuff too, so.
Yeah.
Cause we're seeing, we've actually seen methamphetamine in our drug screens. So we know there's a methamphetamine house someplace in the 2 counties, Scotland or Robeson County. We've seen a lot of fentanyl. So we know that is very available here in both, at least in both counties from the patient population we see. So I just wondered if they knew what, if they know based on maybe, and Robert may know if they did.
He may,
Any kind of testing with, the overdose death, so.
So we're hoping, I know that Kevin doesn't want to bombard the audience with a lot of statistical data.
Yeah.
We're gonna have some posters like with some of that kind of data around so people can actually see it. He really wants this to be more of an open
Just a
discussion. Yeah, and we're also gonna have a personal story from a mom and dad who maybe has lost a child due to overdose. Because personal testimonies are always so nice to hear. And it gets people involved, I think, and emotionally involved and want to help. So we'll see how this first one goes.
Yeah.
Again, it's our first one. We don't know how many to expect, but it will be at the SACS. We're having roundtables. So it's not going to be anything where people feel like they're being lectured to.
Yeah.
Just an open discussion. We will have, things at the table that they can use to write notes with or ask questions and turn them in, stuff like that.
Sounds good.
So I appreciate you not wanting to bog down the presentation with a bunch of data. However, it would be important for him to allow someone to point out what the trend has been.
Right.
we cut it in half, right? And now it's way past where it was before,
Correct.
at least nationally.
Mhm.
So we're like 100,000, we're down to 40,000, now we're back over 100,000 deaths per year. I'm sure the trends here are the same. You know, most of that's fentanyl brought in across the Mexican border.
That's right.
Dr. Gay, I think, has some awesome slides that she will show. She will be the only person really showing those types of things, and then we'll talk about some of that, and hopefully, though, we'll have some posters like for people to actually see some of that trend data. That's so important, have to show what's happening, and right here at home, too.
All right, good. Thank you.
Mhm.
So we're through with department reports.
Janet, is there anything you would like to add on?
There's a line item here, unfinished business, that we got some unfinished business that I'll.
There's one.
All right, new business, seafood ordinance.
As I was stating earlier, it was brought to my attention when a new seafood market was wanting to open, that our ordinance hadn't been updated since January of 1980. So I reached out. Valentina is here if anyone has any questions in regards to the ordinance.
Valentina, is that who?
Yes, sir.
She's our environmental health
Okay,
supervisor.
she's in charge of all seafood markets.
Is this that would keep
This new seafood restaurant from opening, is it?
They are.
They already opened
They're open.
Is this a seafood market or a restaurant?
a market. They
Well,
sell fish.
Oh, no, they're up under these total different jurisdictions.
Not all counties within this, North Carolina have a seafood ordinance. I reached out to different ones and some of them said they don't have seafood markets in their county, so they didn't see a need for an ordinance. We have 3 with this new one opening. And foodborne illnesses, you know, we're public health and we're looking out for the citizens, so there's a need for it. Val, do you wanna explain about the Department of Agriculture, how it comes into play too?
Yeah, so the Department of Ag, I don't think I have been formally introduced to the Board of Health meetings, members. I'm Valentina Oxenine. I am the health inspector here in Scotland County.
Does that mean you work for Amanda or you
I
don't?
do,
Okay,
yep, she's my boss.
okay.
what's going on with the meat department that thing? Is it gonna pass?
We, he finally got his finals, yes, sir. We were waiting on building inspection and fire marshal to actually go in and issue his finals, so he should be set to open up here in the future.
I mean,
Soon as he calls me in,
Downtown, oh, that's Southern Way. It's opening one in downtown.
Yeah. right here, and he also has a restaurant in Gibson.
Right.
So he's opening up a butcher or a meat
A butcher
market
shop.
down
You
on Main
can get a
Street.
good steak or whatever you want.
Mhm.
Hamburger.
But the seafood ordinance is a local ordinance, and like Ms. Amanda said, we kind of pulled some different ordinances from other counties and kind of combined it together. There was really no new things added except for some definitions and just making it clean and really easily understood when people needed to read it over. I think the old ordinance was just so old, it was, misunderstood, and even the paper had turned yellow, it was just that old. So,
It was actually done on a typewriter.
yeah,
Was, yeah.
so basically floors, walls, ceilings, when it comes to a seafood market, we also look at cold holding, how, they cold hold the things until it is ready to be sold. They also fillet fish in place, so if you wanna go in there and get you a spot, so you can cook on a Friday night, that you can fillet it and, get it ready for you. And then all the other things, meaning, that they have their gloves or they're following protocol when it comes to being safe doing handling and preparing. We also work with Food and Inspection Department on that too, when they they give files with that part.
So the legality of this, we don't establish an ordinance, do we?
Yes, sir.
We have to approve this, right?
Yes.
And it becomes an ordinance, it's to go to county commission or something first.
The county attorney said that, this one did not have to go to the board of commissioners.
Did you say where it was?
It is in the little, strip mall there by Sally's, right in the Walmart parking lot.
It's called Seafood Express, it's the newest one.
Yeah.
And there's two other ones.
That's on Caledonia Road.
They're also new?
They are older.
What, I didn't hear where this new one is.
It's by, Walmart, in the Walmart parking lot over by Sally's in that little strip mall.
Yeah.
That's over to the side.
Uh-huh.
It's in there.
So I didn't read every word of this, but I did read the back of it. So you can tell them they're in violation.
Yes.
They can appeal to Amanda.
Yes.
Correct.
They don't like what Amanda says, they can appeal to the Board of Health, so we may have to rule on how they're handling fish. If they don't like what we said, then they go to district court,
Correct.
which
So
is
they're
kind
just selling seafood, they're just selling seafood, they're not cooking.
No, they're just selling.
And that's where the confusion came in, with the new market. She knew that she had to get inspection from Department of Agriculture, but she didn't realize, seeing that she wasn't cooking, that it had to go through us as well. But we've had this county ordinance since 1980, and it's posted on the county website.
So does that mean that she can impose a $50 fine? Who is it that settles, that determines the penalty? It
That
says the
was,
penalty is $50 fine or 30 days in jail. Now,
That
which
would
one of
go
those
to the
I did.
attorney.
yeah,
That would go to the attorney.
the attorney would decide the penalty?
well, the penalty was on the old ordinance, the ordinance that we're
Oh, this
going
is-
by from 1980.
And it's per general
And so-
statute.
Mhm.
Okay. That was when $50 was worth a lot more than it is.
So did the penalty, did the monetary penalty say the same?
Probably.
But now this is
That-
just a
that may
draft.
require an act of
You
legislature.
guys can, you know,
It looks
change
like
that if you
everything's
want
pretty
to,
good.
because this is just a draft.
Well, no, I mean, as provided in section 203, chapter 130 of the general statutes. So I imagine that's not, we probably can't change that. Look at that $5,000.
And we do have an inspection sheet that we use for their grading based upon the rules that we have in the ordinance. So they do get grade cards
I mean, like a restaurant.
like a restaurant.
So a seafood place can have a B or a C.
That's correct.
How
You
about
also expect all the
$160
restaurants?
I do.
how about $163.35? That's what $50 in 1980 is worth today.
Wow.
So
They've seen it, seen like it works.
it's gone up $113.35 in 41 years.
And another $13 this year. Anyway, all right, so, has everybody had a chance to review this ordinance, which apparently
It looks
is,
like it's done very well, actually, so pretty much it, so how often would you inspect the fish market?
With this ordinance in place, it would be every 6 months.
Every 6 months?
that's
And the
more frequently
USDA,
than your restaurant.
US Department of Agriculture does it every 2 weeks. They're
Every 6
every
months.
2
Unless
weeks.
there are complaints.
No,
or
with
something.
restaurants, it falls upon the jurisdiction of the state. So we have, compliance states that we have to meet. 4, we're category 4, meaning like a restaurant that does a lot of processes, like your Golden Corral, has to be done 4 times a year. And category 3 is like a Smithfield's, has to be done 3 times a year. Category 2, like your Hardee's, has to be done 2 times a year. And category 1 would be like a lodging, so a hotel has to be done 1 time a year.
So this would be how much they actually do cooking and processing
Based
on
upon the
site.
processes that they do.
So McDuff's would be a 4.
McDuff's is a 4.
All right.
And when it's,
We're learning something.
when it's a new establishment, whether it's a seafood market or a restaurant, I don't think a lot of the citizens understand that we're like the last ones in. There's, building inspections and stuff that have to be done before we actually go in. So if it's a new restaurant, we have to wait till all of that's done. So if you hear that the health department shut them down before they open, that's not the case. Sometimes it can be the building inspections.
Now, the health director and myself approved the plans, especially when it's its own, an independent person like Captain Larry's. I'm just throwing out restaurants so that you can kind of, so that you can visualize what I'm saying. Opposed to a chain restaurant, which would be like your McDonald's or your Bojangles. Those are usually, approved by the state, the plan review committee.
The plan, but you actually inspect those places for the state and these places for the county.
That's correct.
You get 2 paychecks.
I wish.
And right behind Ms. Bean is Harley Winton. She's our new environmental health
Yes.
intern. And she's almost done with her food and lodging, so she will be inspecting.
Shortly.
Shortly.
That'll give me some help.
All right. Be careful. You're getting closed down out there. Closing down if they need to be closed.
Yeah.
All right, so I guess this comes before us as something we need to vote on. And, just want you to know, it's been 42 years since this has come before this board. We're making history tonight. Thank you, Madam Director. Anybody want any further discussion regarding this? If not, can I have a motion that be approved?
I'll make a motion to approve it.
Is there a second? Okay. Any further discussion? All in favor, say aye.
Aye.
Opposed? All right. What other policy do we have that I didn't know about? Okay, strategic plan, Jana Blue.
Good evening. It is time to update the agency strategic plan. And we have done a lot of work on this over maybe, the past year now. We started back a year ago with our SWOT analysis, and identified some strengths, weaknesses, opportunities, and of course, threats, for the agency. And, we have proposed, 5 specific goals that we're looking at to help us develop services, meet the needs of the community, and grow an organizational structure that help us provide efficient services. So I will review for you. I think you have access to the proposed plan, and it is up on the screen, but I will give an overview of those 5 goals. The first of those being to promote health behaviors in the community to enhance individual health and wellness. And we will do this by encouraging healthy lifestyles, by promoting increased physical activity, healthy eating, quitting smoking, vaping, or tobacco products, and substance misuse, reducing the community risk of chronic disease and outcomes with regards to health and wellness, improve current collaborative efforts throughout the community to evaluate current active status and meeting frequency. And that's a lot of words. So just over the past 2 years, several of the partnerships that we had prior to the pandemic, people have just changed. A lot of turnover, things have happened for different reasons. So we will be evaluating those to see how we can move forward. We also propose to support and promote community-wide mental health and substance misuse services. You've seen some of that work come to fruition in the flyer that was presented to you tonight. Invest in community-led solutions to advance health equity. Am I flying ahead of the slides. Alrighty. Ensuring public health is prepared for emergency response in a disaster or communicable disease outbreak. And to enhance recruitment efforts, employee engagement, and succession planning initiatives that contribute to individual and organizational effectiveness. And provided here in the table, under each of these, you also see our evaluation methods, a timeline for completion, and a timeline for assessment. And I think most of these are 6 to 12 months benchmark checks for each initiative. And these are the hardworking folks that have come together several times over the past year to provide this final proposed draft to you.
I guess it's,
Yes, sir?
I guess it's something we're supposed to approve as well.
Yes, so if there's any questions or additional information needed at this time, I'm happy to provide that. But this is our final draft that we submit for the board's approval.
And how can we get to this? Is it on the website?
Not yet.
Not.
This is internal document at this point. This is a draft. Once it is approved by the board, we will distribute it in the public and on the website.
This is an accreditation requirement.
Absolutely.
It's required for accreditation, so that's why it's come before you.
All righty,
Requirement, let's do it.
I would take a motion to approve it, is that right? Second, is there any further discussion? I did look through this, and the only thing I see that, I agree that inconsistent legislative funding and public health, all that legislative stuff. But it sounds awfully partisan to say that a threat is a conservative government, and what does that mean anymore? Because there's a conservative pro-vaccine, anti-vaccine. You got Biden pushing Trump's agenda, Trump's vaccines. It's kind of a crazy world. So, I don't know how the creditors will look at that. Is that?
So I think you are looking in the SWOT analysis.
Yeah, it's a threat, yeah.
Absolutely. So this is a compilation of some things, some observations that the team put together. And I'm sorry, that is on page 4. Yeah.
So I'm sure that, it goes both ways, or more than two ways these days. So is that part of the plan?
No,
So that's just.
these are
analysis?
observations.
Okay, all right.
Yeah,
So
this
the
is,
plan
so
starts.
the plan starts with the goals.
I just don't know that I'd put that up on the website, is what I'm trying to say. But, that part of it. But that's not, we got a motion and a second on the floor, so, is there any further discussion? If not, all in favor say aye. And thank everybody for their hard work.
Thank you.
Now we got some, we're gonna go up a dollar on vaccines.
Tim,
Who's got that?
Tim,
What's that? I'm sorry.
a request for approval for the following.
Oh, yes, every year we have the flu vaccine, we have to set a new fee if it changes. Last year, we received a different flu vaccine. So we went back this year to the one we had previous year, and it went up $1. Just as a reminder for our vaccines, whatever the cost is to the county, we times that by 5%, and then we round up to the nearest dollar. And that gives us, so we make a little bit of money off of the flu shot. Plus also, we still charge a $25 admin fee to, so if someone walked off the street right now with no insurance to get a flu shot here would cost them $45.
I guess that comes to us from financial guru, so we have a motion to change that fee. So
I'll
moved.
make a motion.
Is there a second? Any further discussion? Being none, all in favor say aye. Opposed? Looks like we got another one.
The reestablished, the meningococcal.
Meningococcal.
Yeah, the magenta, I see, I can never say that word. They actually changed, the vaccine is now meningococcal, is that right? But it's a new CPT code. Anytime we have a new CPT code, we have to make a fee for, and the fee has to be approved by the board.
Can I get a motion for that as well?
Yeah.
Make a motion.
Is there a second? All in favor say aye. Opposed? Okay, so looks like we're doing all our business. Informal discussion.
There's one more thing, reestablishment of the COVID-19 vaccine administration fee. There's been a reason.
Okay, that's fine. There it is.
I think when Dr. Caldwell was here, he brought it in front of y'all about discontinuing the administration fee for the COVID-19 vaccine. COVID-19 vaccine would still be free, it's free. But the administrative fee, if they have insurance, we would like to be able to bill the insurance $25 to recoup some of the time that our nurses are spending getting these vaccines. We're having our fall booster next week, and we've already, I think it's like 125 people that's already on the schedule. So that's a lot of nurses' time that could be billed for through the insurance. If the insurance does not pay, it's still no cost to the patient. So we just wanted to bring it in front of you to see how you felt about that.
Well, I think if you charge an administration fee for the others, then you can certainly charge it for COVID. And if they don't, if the insurance doesn't pay, then the patient doesn't have to pay, so
Right.
that's the general policy.
How do the customers feel about it? Do they don't care one way or the other?
As long as
It
they're,
says it's free, you can bill the
As long as they don't
insurance.
have to pay it.
As long as they're properly educated on the insurance part,
and that it's no cost to them. And I know, like, with county employees, we have a high deductible insurance. So if something is billed to our insurance, it's to our benefit because it helps, even though we're not paying that, it's gonna show
it
on
counts.
the
towards
insurance, it's gonna help us on our deductible.
So you bill it, if they don't pay it, and they get credit for it on the deductible?
Yes.
Is it a charge?
It's a charge.
Okay.
I make a motion to reestablish the fee.
Any further discussion? I'll just say that I know that in my business, if I charge less than Medicare, I can go to jail. I can't give anything away, hardly. Every now and then I give the service away, but I can't give away an X-ray.
Yeah.
I never understood why we made that change really. Previously, as long as the patient was not charged, as long as the insurance paid, because they are allowing a payment. It's not like it's not a fight, it's approved. And it explains them up front, like she said, is educate them, say, look, they are willing to pay this and it won't cost you a penny.
It's just like a flu shot, it's the same thing.
All right, so we have a motion and a second on the table. All in favor, say aye.
Aye.
Opposed?
I'm opposed.
Okay. So that's one opposed. Informal discussion. What booster are we getting next week, the 125?
That's all those two.
But what booster is it? Is it the quadrivalent? Is it the new one with the bivalent?
The bivalent.
Any other informal discussion?
So how is accreditation going? How's the accreditation process going?
Do you wanna speak on it or you want me to speak on it? I think some things were kinda left undone. But me and Jana have gotten together and we're pulling the things that need to be put into the data dashboard. Some things were actually done, but not entered into the dashboard. So we're in the process of doing that. I think our next site visit is it 2024 or 2025?
It goes through 2025, so our visit will be winter 2026.
Because they extended it a year.
2 years.
We're working on it.
Anything else to come before the board?
Move adjourned.
All in favor, say aye.
Sharon.
This would be a good thing to put down.
You got a copy of this?
You have a